The world of regenerative medicine is an extremely fast-growing field. However, it is being overtaken by fraudulent stem cell clinics, sprouting up in locations all over the world. Despite this, the FDA has limited regulatory oversight over many of these institutions, leaving us to question their safety and validity.
Tonight we'll be investigating Dr. Dennis M. Locks, the supposed miracle man who has set up 2 stem cell clinics, one in Clearwater Hills, Florida, and the other in Beverly Hills, California. The map on his website lists hundreds of alternative locations in order to increase the frequency of his search results. You may have seen him on a multitude of news shows documenting his cure-all stem cell treatments. Tonight we'll see if he lives up to all of his claims.
These clinics all stem from one man, Dr. Dennis Locks. Locks attended the University of Arizona for his undergraduate career and then attended medical school at Texas Tech. He did his residency at the University of Texas San Antonio in pain management. No evidence exists thus far for us to doubt his attendance at any of these locations.
Alongside this, there is no indication of him receiving any sort of specialization in stem cells or any regenerative medicine certificates, despite him claiming to be an expert in these fields.
Despite what seem to be legitimate medical degrees, Locks is making his money by leeching onto helpless individuals and making Miracle Man news appearances to recruit more and more patients.
His clinics have received support from celebrities such as James Lee, a professional football player, and New Jersey wrestler Nick DiFrancesco, as well as multiple agencies looking for filler news stories, though we will expand on these testimonials later.
First, we will look into Locks' actual procedures in an attempt to determine their validity.
The basis of these treatments is that they are autologous adipose stem cell transplants. This means that the treatments inject a patient's own stem cells back into them and use fat-derived stem cells.
The way this works is fairly simple. Fat is removed from a patient's lower back, centrifuged or spun, until the stem cells separate from the other components of the fat. These stem cells are then injected back into the patient in their problem area.
These stem cells are able to differentiate into bone and connective tissue, though to avoid FDA regulation, Locks does not mix the cells with anything so as to expand or differentiate them.
Locks has released no information as to how these stem cells know how to fix the variety of issues he claims to cure, simply stating that the cells will home into the area of inflammation and somehow help.
All things considered, these procedures are very simple. Locks does not have to transport people outside of the U.S. to complete them and can delegate the procedures to technicians and nurses.
Thus, Locks does not complete the procedures himself, especially given he runs clinics on opposite sides of the country. With our skepticism on the efficacy of these treatments, we then looked into a variety of testimonials.
Locks' websites are ripe with testimonials, though most of them appear to have some form of a sob story appeal. He tells the story of a young girl able to continue her soccer career due to the success of his injection, for example.
Despite this, we noticed that many of the people he used in his testimonials were also people who participated potentially for payment in his radio show, making them of questionable validity.
Further investigation into the testimonials showed that Locks himself actually revealed that he has a testimonial blog full of amazing success stories. Despite this, these stories provide no more than words in a stock photo, meaning that there's actually no way to know if they're valid or not.
With such questionable validity, we decided to look beyond Locks' websites into medical review sites such as Vitals.com, and we found that he had an alarming number of purely 5-star reviews.
This is pretty off-putting, as almost nothing has such a vast number of reviews like this. But we did find that the majority of these reviews were simplistic and most likely fake.
To further extend this, some sites did have a fairly decent number of 1-star reviews, which documented a huge lack of success with major out-of-pocket expenses, and also claimed that Locks made them pay in cash, potentially in an attempt to avoid taxation and regulation.
With this in mind, Locks is seeming more and more like a fraud. But let's take a look into the actual cost of his procedures.
Locks' entire website actually fails to mention payment, as the closest it comes is a page regarding insurance information. This suggests fraud based on the reviews documenting cash payment, as he could not present a method of payments on his site if none exist.
Alongside this, little helpful information is present on this page, and some reviews stated that Locks began overcharging their insurance for unclear reasons. With this, we decided to take matters into our own hands and find out more about the clinic.
We called both of Locke's clinics and asked them numerous questions in our investigation. To begin, we asked about what they can treat.
They were realistic, only claiming to be able to treat joint-based strain or injuries. They could not treat breaks or celiac disease, an autoimmune disorder, but did agree to treating issues not mentioned on their site. Take a look.
I have hamstring tendonitis, in my right knee. And I didn't see anywhere on your website that was treated, but I was wondering if that would be possible for your stem cell treatment to fix tendonitis.
Yes, it does.
This was not of major concern to us given its similarity. We did, however, also ask about the costs. Here you will see both clinics' responses.
And then how much would something like that cost?
They range anywhere from 5,000 to 8,000, but if you are having one joint is on the lower end, and two or more would be in the upper end.
Okay.
After that.
Okay.
Well, I'm curious about how much it would cost because, I'm a college student, so I want to know how much, if you could give me an estimate for that.
Okay. The procedure usually ranges anywhere between $5,000 and $9,000.
Okay.
Usually one joint is closer to like the 7,000 range. Multiple joints is closer to 8,000 or 9,000.
Okay.
Given what we learned earlier about the cash payments, these costs are rather ridiculous, especially with minimal scientific backing. The patients are also provided with minimal follow-up, clearly stated by the clinic.
And then how long would it take for me to recover after the procedure?
Well, there is no actual recovery like a rehab or physical therapy like you would think, but it's just we just recommend you take it easy for about 2 weeks, at which time, if you're local, you would have a follow-up appointment with Dr. Locks, but otherwise you would just check on you.
Okay.
during the time.
So there would just be like a little minimal follow-up?
Right, yep.
Okay.
We would most likely do phone calls and follow-ups with you
Okay.
every so often, see how you're doing.
Okay.
And that's where we keep track and see if you need any follow-up visits or procedures or anything like that.
Okay.
The clinic simply admits to minimal follow-up, clearly being an issue as all medical procedures should involve follow-up. They do seem to have it as an option for a pushy patient, but are more interested in just the initial procedure.
To back this, they claim that the initial procedure is safe.
How safe is it? Because I've been hearing things about cancer, and I don't want to chance that.
No, it has nothing to do with, there is no cancer, there's no surgery, so it's a lot less invasive. There's no real chance of any rejections. It's your own cells.
Okay.
And the progress is pretty significant.
Okay.
Are there any risks associated with that treatment? Is there any risks that might happen
No.
with the stem cells?
No.
Okay.
He thinks I'm going to get cancer.
There's no possible way of that happening.
So then, do you have any other?
Is there a possibility for like tumor growth at all? Because throughout the
No.
news, I've seen stories of people somehow getting cancer and sometimes even tumor growth because the cells migrate.
That's not possible.
These safety claims are absolutely ridiculous. Stem cells cannot be controlled within the human body and are capable of leading to both tumor growth and cancer, as undifferentiated cells are unpredictable. Stem cells are self-renewing, thus this renewal could get out of hand and cause cancer, or a tumor could form with renewal of the wrong cell types.
With this information in mind, let's see how much they know about how the procedure really works.
How does the procedure work? How would it fix my knee?
Okay, so Dr. Lux uses an adipose stem cell tissue, which he takes from your lower back. All right, and he processes it in the lab and refines it to get pure stem cell concentrate, and then he injects it into the joint or wherever it is that you're having an issue.
Okay. And then the tissue fixes itself?
Yes, whatever's the damage to the stem cells, if you're and they regenerate and regrow tissue and cartilage.
Oh, okay. And how does it work? Because I did a little bit of research, but I'm still really confused about how the stem cells actually work, you know?
Yeah, okay, so the way that we actually get the stem cells is from your own body. We do a mini liposuction on your low back. We don't put you to sleep or anything like that. We use a local anesthetic. We take the adipose tissue from your low back. It's over by like where your love handles are.
Okay.
We usually take out about 460 ml syringes of the adipose tissue. While you wait, we take it into our lab. We spin it down multiple times to extract just the stem cells. Once we've extracted just the stem cells, we create an injection with that stem cell, with your stem cells, and then we inject the problem area.
Yes.
Okay, and so you're able to control which cell type it turns into.
Correct.
Okay, I'm very interested how you control which stem cell it turns into, or how you differentiate them.
Because it's injected into the joint.
While the treatments are simple, they could not explain how the stem cells would actually fix the damaged area with any degree of accuracy. These injections are essentially pointless and are used to separate people from their money.
Based on our investigations into Dr. Locks and his treatments, we have determined that Locks is a fraud, and his treatments have minimal scientific basis. Evidence to the efficacy of his procedures come only in the form of patients' testimonials, which are potentially bribed or scripted.
Although Locks does not claim to be able to cure any disease through his treatments, he does state that any joint-related issue in the human body may be cured with stem cells, which is a scientifically inaccurate statement and fails to uphold his claim of expertise in the field.
In an effort to gain a professional opinion on Dr. Locks' clinics, we contacted Dr. Paul Knopfler, a world-renowned stem cell scientist at UC Davis. Dr. Knopfler stated that, more globally, he was not aware of FDA approval or solid data to support these kinds of offerings overall as safe and effective.
Locks is a fraudulent individual who claims his treatments have no risk as they involve taking cells from your own body and replacing them back into yourself. This makes absolutely no sense. Locks is scamming people for their money and is not a legitimate professional. With clinics like this sprouting up everywhere, please proceed with caution.